Hi everybody, I'm Donna Taylor. I'm Infection Prevention and Lead Nurse at Trinity Hospice. I wanted to talk to you about mask wearing. So this week we've requested that colleagues help us to prevent flu and COVID infections in Trinity by wearing a mask. And that mask is to be worn when you're in an office of more than 2 people and while you're sat at your desk. Why are we asking you to do this? It's a simple answer. We're seeing infections from respiratory illness escalate rapidly across Blackpool and the northwest. So we've got high levels of flu, high levels of COVID, which is making people poorly. And not only that, it's putting strain and pressure not only on our own organisation, but on the hospital, on care homes, on the public in general. And we're seeing unprecedented levels of flu, hospital admissions escalating rapidly. In fact, to quote a statistic, the UKHSA said that flu admissions to hospital had gone up 120% between last week and this week. So that's quite staggering. We've never been here before. It's unprecedented. So we're asking all our colleagues to take this additional step. Wear a mask to protect our colleagues. Predominantly if you're in an office where there's more than 2 people. If you're sat in an office on your own, like I am right now, it doesn't matter, does it? But when we're with people, we need to protect them. And wearing a mask will provide that protection. It stops aerosols generating when people cough and sneeze. And believe you me, an aerosol can travel a long way, land on surfaces. We touch them, we pick them up on our hands, we rub our noses, we rub our faces, and we infect ourselves with cold and flu. And I know this seems a strange request, particularly to people who are sat in administration offices who've maybe not had to do this before and weren't necessarily asked to do this at the height of the pandemic. But we're requesting this so that we can get through the next few weeks, that we can make a little bit of an effort now, which means we protect our staff and our patients. And remember that COVID and flu are severe viruses. They make people poorly. The elderly can die of flu. It's not a nice disease to have, is it? And it ruins your plans. So by wearing a mask, by washing our hands, by opening the windows, we can reduce transmission between each other. If we hold on now, by the spring, we can probably dump masks. I hope. Fingers crossed. But we need to put the work in now. And remember that with these viruses, you can be infectious 3 to 4 days before you actually show any signs of the disease. So you could be sat next to your colleague who's coughing and sneezing, who's actually spreading diseases, or you might be yourself incubating a cold or a flu. So the more we do now to protect ourselves, the better we will support the whole health system in Blackpool, which is really struggling. I also wanted to mention the importance of vaccination. Vaccinations are safe and effective and a way to reduce the impact of flu and COVID. So if you haven't had a chance already to go and get yours and bring yourself up to date with your boosters and your flu vaccine, please do. It is a really safe way of protecting our families, our patients and ourselves and our colleagues. So thank you. So just to recap, we've talked about the importance of mask wearing, we've talked about the importance of vaccination and other simple infection control measures like opening a window, washing your hands, using a tissue if you've got a cough and a sneeze, putting that in the bin is important, and washing your hands. And I've worked at Trinity only a small time, but I already see the commitment of the staff, wanting to protect their patients, wanting to protect families and wanting to protect each other. So we're doing the right thing and I really want to thank you.